This is the Alden Report.
Today's episode is brought to you by FrontRowBenefits.com, connecting consumers and businesses with front row access to the greatest health insurance that the United States has to offer. Visit FrontRowBenefits.com. Folks, listen, if you're like me, if you own a business, if you have a family, or if you're an individual and you're looking for front row access to healthcare, maybe you're tired of your premiums going up. Maybe you don't want to pay those high deductibles anymore. Maybe you're tired of paying more and more for your monthly prescriptions, and you want to make sure that you're getting that VIP access, that front row access, then visit FrontRowBenefits.com and get a free quote. They're connecting consumers and businesses with the top level insurance carriers in the United States at discounted prices. Visit FrontRowBenefits.com. That's FrontRowBenefits.com.
This is the Alden Report.
All right. Well, my name is Mike Alden. We are here in Blue Bay Studios. I look a little bit different than I've looked over the past few episodes. I'm usually rocking my 99-cent glasses. Sometimes I got a hoodie on and a hat on, but this is not one of those types of episodes. I feel like I need to really, step it up a little bit. I didn't put a jacket on, but, I look somewhat presentable. We're going to be talking about a subject that it means a lot to me. And it is something that has affected, my life. And I don't know that my guest even knows this, but let me just start out by saying my stepfather died of AIDS from an overdose. Started out shooting heroin. My mother actually was infected with HIV as a result of him. My father was addicted to cocaine. I lost a brother to an overdose. My stepmother died of an overdose. Another brother was in rehab, and I've lost numerous friends, both actually lost them because they're no longer here on this planet, but I've also lost them because they have forever altered their chemical state. And it's a really, really sad thing. My next guest is Dr. Arun Gupta. He has been a practicing doctor for over 35 years. He's written a book called The Preventable Epidemic. It's somewhat of a very, very kind of controversial title in and of itself, but he's here today to talk not only about the book, but what you can do. Now, listen, if you have a family member that is suffering right now, if you yourself are suffering right now, or if you have a friend, this is one of those episodes that not only you're going to want to listen to, but you're definitely going to want to pick up the book as well. He's spending his time with us today. He was super busy. We're trying to work out the schedule. The guy's a little in between his practice and now. So please help me welcome Dr. Arun Gupta. Dr. Gupta, thanks so much for being here.
Thanks, Mike, for asking me to join you today.
So, look, you heard my background a little bit. I know you kind of knew a little bit about that, knew a little bit about those story. And, the statistics are staggering. To me, they seem to continue to grow with the opioid crisis. And we all talk about it, but no one's really doing anything about it. And
that is true. All the discussion is informational, it's not actionable. So we need to put some action together. Yes.
And that's exactly what you're doing. So talk a little bit about, let's back up. Let's go back 35 years, 36 years when you started practicing. You were a general practitioner, I guess.
Yes.
What was the impetus for you to decide that you are going to dedicate a good portion of your life and your practice to helping people, with this crisis that continues to get worse?
Yeah, it was not in my genes or in my forte that I'm going to end up doing this stuff. But from 1995 to 2006, I was a local jail doctor. I'd seen a lot of misery that we don't see in the office practice and the hospital setting. And as I was relieved of those responsibilities, I started wondering what is going on. So I became a member of American Society of Addiction Medicine. They taught me a lot. And over the next 5 years, I joined their meetings twice a year from April and October for about a week every year. And they got me into foots that I got comfortable doing my presentations on my own and talking to people and educating others. In 2017, I had too much regulation in the hospital setting and nursing home setting and office setting, and I was getting burnt out from working in all three locations. So I quit doing that stuff at the hospital and the nursing homes. I had a lot of free time, And one of my friends asked me a question, when is all this going to end? CDC had just reported that 700,000 people have died between 99 and 217. So my focus changed in my presentations and research as to what can be done to prevent the overdose deaths. After 2 more years of research and writing, I felt that I had to write a book because my message was not making a bigger difference. And that's how I ended up into this situation with trying to educate people. And now I think we need to educate and advocate the legislators, the policymakers, the insurance companies to make some sensible regulations to resolve this issue.
Yeah. I don't know how much time we have, but I have a ton of questions for you because, again, a lot of the personal experiences that I have with family members. Let me ask you a question about rehabs. I'm using the word rehabs in a kind of a broad sense because I know you have detox centers and then you have rehabilitation centers. Tell me what are the differences, and then also what are the real problems with them just in general?
Well, I do not work in that space, but from what I know, there are 14,000 inpatient rehab facilities in America, which probably close to 1 million beds. And anybody who goes in there feels good for a week, 2 weeks, 1 month, whatever they can afford or the insurance affords. But then they need outpatient follow-up with people like me. But we are only 18,000 providers that could cater to less than 5% of the population that is at risk. So we need a lot more of providers that have XT number and experience to treat these people as an outpatient on a longitudinal basis. The detox centers you're talking about, rapid detox, they are relatively dangerous with very short-term benefits, but long-term very risky and not proven effects. So FDA does not like those places, and I don't think they have the success that they promote.
Finally, I think in the last actually legislation, which is interesting, the largest drug manufacturers were actually somewhat held accountable, and they hadn't been accountable for years, both civilly and even criminally. But only a few people really faced any sort of criminal charges. Talk a little bit about that in that world and really kind of where a lot of this does stem from.
Well, a lot of it stems from the Purdue Pharmaceutical have the ability to circumvent the laws that we guys, the small people, cannot fight, even as doctors. So, you've seen this serial came out, Dope Sick, and I knew before I watched that serial, or it was going to come out, that the test that I took for myself is very, very difficult. After I watched Dope Sick, I think people are fired up and frustrated with how things have happened. But I think my book is going to be a relief and give a way how to salvage this problem. There were several places where there's a government accountability documents, GAO official documents, that came 8-9 years after the original concerns about the Purdue and the OxyContin, but they didn't do anything. Even after the OxyContin and Opana were made abuse-proof, they had more medicine in it, and there was a dispute between FDA and DEA about the real sense of concern, and that made things much worse. But that led to the heroin overdose, and now it's the fentanyl overdose in the last 4 or 5 years that's killing people.
We've been hearing about the war on drugs. I think it was Nixon, right, that declared war on drugs. And so what was that, 1970 something, right?
Yeah, 16, 17.
Yeah, and we're losing. It's the longest war that the United States has ever fought, and it continues to fight. And probably, actually, your book probably even gives the numbers, but we probably lost more than all wars combined. Why are we losing this war? In your book, you address it and talk about again, the title of your book, The Preventable Epidemic. Talk about this war on drugs. Why are we losing it? And what are some of the things that we can do about it?
We cannot regulate ourselves out of this mess. We have to have compassionate care, access to care without any limits, regulations, and oversight, so that the physicians don't feel threatened that they're going to lose their license or go to jail. More than 1,000 physicians have been taken out of practice. and face legal consequences taking care of these very tough patients with either chronic pain or addictions. My concern is if FDA did not conduct a study on a given drug about diversion and overdose and death, then the responsibility should not fall on the physician about this diversion and overdose deaths. So, and they're throwing all the responsibility at the physicians in this country, and that is not right.
You know, you talk a lot about regulations, and you and I have talked offline. Again, I don't know if I told you about this, but I've been to DC. I've lobbied for bills. I worked in DC as an intern. I'm a lawyer by trade, so I, depending on what side of the table I'm sitting on when I was practicing, I've advocated for different rules and regulations. Look, listen, we're in a world and a country that has laws for a reason and rules and regulations for a reason. But, you talk about just the inordinate amount of rules and regulations that make it almost impossible for you to practice and provide care. Talk a little bit about not only the stressors that you have faced, but other doctors that are really trying to help and their inability really to do the right thing due to regulations.
Well, the problem is there are thousands and thousands of regulations that have come with electronic medical records, ICD-10. There were previously existing regulations of how doctors should practice, behave, take care of business. And then when DARA 2000 was passed in the year 2000, trying to improve access to care for patients with addictions for preventing the overdose deaths, instead of improving the educational curriculum in the medical schools, they said any practicing physician could do a course, pass an exam, and apply for an XDA number. And then they put a limit of 30 patients per month. And if they do that for a year successfully, they reapply they can get up to 100 patients per month. But
hold on, let me stop you right there. You use the term. I'm not sure. I'm familiar with whatever. So what you use the SD light? I think you said SD. What is that? What is that?
XDA number.
Okay, what's that?
That's a license from the DEA. You'd have to have it to write the treatment arm of the medication for the drug problems.
Okay, all right, I get it.
So the medicine is called Suboxone or buprenorphine, and the newer version is called Subzol.
Okay.
So without that XDEA number, no doctor or nurse practitioner or physician assistant could prescribe that medication. And only 1% of the providers in this country are actively involved in the taking care of patients with addiction in this country.
Why is that? Why is it such a small number? Because of the regulations?
Because of the regulations. So when you take 1,000 physicians out in the last 20 years, the others pay attention and say, I don't want to go into that space. I don't want to lose my license. I do not want to be humiliated. I don't want to go to jail and become homeless. In my small town, rural town, we had 3 physicians taken out in 10 years. And I know at least 20 people personally that have been apprehended.
Is that because they were prescribing things, I know the term like, kind of off label or what have you, or just outside of their.
So they were accused of running pill mills or writing too many and too frequently and for too many people.
Okay.
So there was a study out from UPenn in 2019, which did not make it into my book, unfortunately, but it said, had the pill mills persisted, this is a retroactive analysis of 2 years of research they did, had the pill mills existed, we would have less number of deaths than they're happening today in 2019, because now the deaths are not from prescription medicine, it is from the street drugs, and fentanyl is responsible right now more than 90% of the time.
In a second, I want to talk to you a little bit about kind of the mental health side of things, and really how people can address it themselves. We're on with Dr. Arun Gupta. He's been a practicing doctor for over 35 years, and he's decided to dedicate pretty much his entire life into helping people get better. His book is titled The Preventable Epidemic, a frontline doctor's experience and recommendations to resolve America's opioid crisis. The book is available everywhere. Look, you heard me talk about this earlier. If you've been listening to this podcast for a while, if you've read any of my books, you know that I've talked a lot about addiction. I've been pretty fortunate. I think I have addictive personality traits, but I've been actually pretty fortunate not to have been addicted to some of these drugs. But I've lost, again, family members and friends. And I think we all have as well. And we're all like, what can we do? We've heard about this war on drugs since Nixon. We're losing the war. No one's doing anything about it. People are doing a lot of talk, but no one's taking a lot of action. Dr. Gupta is taking action, especially with this book. Look, just writing this book is a huge risk for him. And so that's how passionate he is. So if you'd like some more information, go to the preventable-epidemic-book.com. Again, it's the preventable-epidemic-book.com. The book is available everywhere as well. You could just get right on Amazon and pick it up. So, when I try to, I remember talking to my brother Dominic, who passed away, and people would say, Mike, you got to talk to him. You have to get through to him. Like it was my job, right? And I did, and I talked to him until I was blue in the face. But I knew at some point, and this is kind of the sad thing, I knew at some point it wasn't a matter of if, it was when he was going to die from it, because I could just see in his eyes, in the way he spoke, his demeanor, everything, that he had just crossed a line that I don't think he was ever going to be able to come back from. I've been to rehabilitation centers, different types, and the private ones. I've, in fact, Passages, my old company, we were the ones that did the first infomercial for that. I've been to Narcanon. I've been to other private ones. I've been to also government ones. And I start to think about the psychological things. Why are we doing this? Like, why have we started to get addicted to it? Talk a little bit about the genesis of it. From, again, it's broad strokes. I guess maybe you can break it down for me, but why does it start? I mean, I have friends that I know that start first, they're in pain, and then it just gets out of control. But talk a little bit about kind of the genesis of it, and then the mental side of it, and the psychological side of why we, as not only Americans but as humans now, it's not just here in the United States, are so addicted.
Well, it is easy to say there is a significant genetic component to the problem, but the environment in which the child is growing up does play a very big difference. And then all these stresses of day-to-day life, and if people have mental illnesses or they're unhappy, and if they're exposed to these kind of compounds that increase the dopamine level, and without smelling or doing anything else, and they feel better and they feel good, that everybody wants to do that. Everybody has a right and desire to do that. So can
I stop you right there for a second? Because
yes.
that's where I say it a lot too, because look, I'm a practitioner of TM. I've been in therapy pretty much my whole life. I talk about it. I try to work through, my own, psychological challenge. We all have them. No one really wants. Now it's like kind of a thing you can talk about it because of the pandemic and people are talking about it. But talk a little bit about that, because, having grown up to where I grew up in a very impoverished scenario, there's not a lot of hope. And so people take these drugs and, like you said, they feel happy. And then they just want to stay that way. And is that really it? I mean, you said environment is a big part of it. I agree with that. I think you're a product of your environment, no matter which way you go.
Sure.
But is that really kind of like one of the biggest causes, that how people are really how they grow up, essentially?
Yes. So, and then if they see the older siblings or family members have mental issues and addiction issues and legal issues in and out of jails, and it's even more difficult for the females because they have a lot more of other things going on that are not in their control. So the kids growing up in that situation with single mom and dad's in and out of jail and have legal problems, it is very, very difficult for these kids to grow up into a stable environment and then not face these challenges later in life. I was recently faced with a question just around Christmas as the book was coming out. What is happening to the children that either parents are dead or are incapacitated? And I don't treat children, but that forced me to think we have another time bomb sitting on our lap that's going to explode in the next few years. And that's a very difficult challenge that we're not looking into it.
Yeah. I think of, my brother who passed away, his girlfriend became pregnant after him. He passed away. She had a child. She dies of an overdose.
Yes.
And her parents are now essentially responsible for that. And hopefully, they'll do the right thing. But yeah, I mean, where do these kids go? And like you said, do they just, are they lost? I mean, the the odds seem to be stacked against kids like that.
Yes. So a lot of them end up in foster care. Some of them are taken up by the families, but the same love and affection and nurturing that the parents can give may not be possible, may not be acceptable to the child. So we would have to worry about those outcomes as things progress or regress.
Yeah, when I think about children too, you'd mentioned earlier, I think you said genetics. I didn't even mention both of my grandparents are alcoholics. And people talk about a genetic predisposition. I don't know that I buy a lot of that stuff, but what are your thoughts on genetics and the role that genetics play in addiction?
Well, there is less than 10% incidence by evidence that genetics play a role, but it's easy to.
That is powerful. Okay, I'm shocked that you said that. I was thinking you were going to say 50%, because you know what? Everybody likes to use that as an excuse. Oh, my family, my mother, my father.
Yes.
But it sounds like, again, what you talked about a little bit earlier, it really is the love and care. It's the compassion. It's how they're taught. It's how it's not even necessarily where they grow up. It's how they grow up, right? So you're saying the science is saying it's only about 10%?
I think so. Yeah. I've read between 6 and 10%, but again, this system tends to overemphasize on the genetic component because we do not have answers for how to fix the environment.
So, as a respected physician for 35 years, you've helped people in different, all walks of life. And you've really, again, you're spending this latter half of your career. I mean, you could retire by now if you wanted to. We've talked about this, but you're continuing to practice to help people. What has been the reaction of your colleagues and your peers and you deciding to focus on, an area where, quite frankly, people actually don't care about? They act like they do, but they don't.
Yeah. So most of my colleagues in my community think I'm crazy, I'm stupid, I'm naive, and everybody's concerned about repercussions. And if they support me, then something is going to happen to them. So I wrote this book for the general public in a simpler language, so the general public would understand what's going on, and hopefully it will encourage the medical communities around the country, and we all together collectively wake up, and then we can educate and advocate the government as to how things need to be resolved. It can't keep on going like this, because 10% of the US population right now is at risk, as per as CDC says, 41 million people, 10 to 11%, and they don't have, 95% do not have access to care. So 10% of the US population could evaporate from drug overdose in the next decade or two, and something has to be done about it. We can't kick the can all the time for the past 100 years.
Yeah, and you've taken on an enormous task. I know you have a foundation as well that you started as a result of this, and you're talking a little bit about the legislation. I talked a little bit about myself having worked, interned for a congressman. I've been to DC. I've lobbied for other bills. In fact, one bill we lobbied for is called the Health Freedom Protection Act that didn't make it past the House. So, talk about the legislative aspect of it. When you wrote the book, the preventable epidemic, there's a few things about it. One, you wrote it like a doctor should write it. You have citations in there. You've gone through and you've backed up all the facts you have, but you've also written in a way, like you said, like the average everyday person, could understand. And that's not disrespectful to anybody, but it's just, look, I mean, when you're talking about medical terms, it can get quite confusing. So you've done that, you've written that, and that's also a lot of the legislators as well. I mean, they're just normal people. I mean, a good percentage of them are lawyers, but they're not doctors. Talk about the legislative initiative and really what your goals are there.
Well, so all we could do is educate and advocate. We cannot do anything beyond that. And the rest is up to them. If I'm given a chance to explain my process, my thinking, I have a slide presentation which I could show them. I can do Zoom meetings, personal meetings, and it is not an easy process for one person to get there. So I'm trying to raise awareness I think I wrote at the end of the book, it's the humanitarian and the peace project in modern times, and the biggest one that's possible. We need to save this country and the coming generations. It could be our kids and grandkids and everybody else's at stake that it needs to be fixed.
In a second, I want to talk to you about, you talk about this blueprint and how people can really kind of take control of this stuff themselves a little bit in your book. I want to talk to you about that in a second. Again, we've been on with Dr. Arun Gupta. He's been a practicing physician for over 35 years. He wrote a book called The Preventable Epidemic, a frontline doctor's experience and recommendations to resolve the opioid crisis. It's available everywhere. You can go to thepreventableepidemicbook.com. You can pick it up. I know he's running some specials depending on when you listen to this as well. You could probably pick it up at a discounted price. Look, if you have been suffering yourselves, if you know somebody, if you have a family member or a friend, which I'm willing to bet you do, you heard some of the statistics already. We're saying that 41 million people right now are at risk. And pick up this book, take a look at the book, read it. Like he had talked about this earlier. We can talk about it. We can talk about the changes that we want to make. We can be empathetic to people's challenges, but if we don't do anything about it, nothing is going to change. So if you really are concerned about a family member, a loved one, a friend, I'm telling you, this book could not only change your life, but it could change their lives. And look, you've heard me say this before, but this is something, again, that if you listen to it in the beginning, that is really has hit home for me. I'm the lucky one in my family. In fact, people say to me, Mike, what makes you so different? Why weren't you addicted? And I don't know the answer, really, because I was raised in the same household. I just got lucky, maybe from some other people that maybe did steer me in a different direction. Today's episode is brought to you by FrontRowBenefits.com, connecting consumers and businesses with front row access to the greatest health insurance that the United States has to offer. Visit FrontRowBenefits.com. Folks, listen, if you're like me, if you own a business, if you have a family, or if you're an individual and you're looking for front row access to healthcare, maybe you're tired of your premiums going up. Maybe you don't want to pay those high deductibles anymore. Maybe you're tired of paying more and more for your monthly prescriptions, and you want to make sure that you're getting that VIP access, that front row access, then visit FrontRowBenefits.com and get a free quote. They're connecting consumers and businesses with the top level insurance carriers in the United States at discounted prices. Visit FrontRowBenefits.com. That's FrontRowBenefits.com. So let's talk about individuals, and you talk about, there are a lot of stories in your book and some success stories, and people kind of taking control of this themselves. So someone's listening right now, and let's say they're suffering with addiction in general. Doesn't necessarily have to be opioid addiction, but I think the kind of the underlying theory of addiction is pretty similar. But talk about what someone can do for themselves when they pick up your book.
Well, first of all, addiction cannot be not easy to just get rid of it themselves. There are underlying mental issues that need to be treated at the same time as the medicine for addictions, if they're available for certain conditions, and others we don't. Like there is not much treatment available for marijuana or for cocaine and stuff because they don't have a withdrawal symptom. That's kind of bad. So people are going to need some medication, some counseling, and some follow-up with the addiction providers. If they are in a serious compromised situation, they may need to be hospitalized for a week or two, but we cannot depend on people just getting to the hospital all the time and not have outpatient follow-up. That's not going to be good.
So it's a comprehensive approach.
It's a comprehensive approach, yes. Yes.
And usually, most people, if they're in their 20s or 30s when this happens, this isn't something that just happened overnight for them. So it took time. So it'll take time for them to kind of kick it as well. What are your thoughts on, well, actually, I want to ask you a little bit in a second about some of the things that you left out of the book, but I'm curious what your thoughts are on the phrase "once an addict, always an addict." I've read the book The Power of Habit. I've read a lot of books about addiction, and I've studied addiction myself just because of my own family background. My understanding is there is a point chemically and physically in your actual brain, the actual neuroplasticity, there is a point where you can get to you can't fix it. But talk a little bit about that phrase, and is it really accurate to say that?
Well, the trouble is the education in the medical system is not adequate or there at all how to deal with his addictions. So it's easy to say, oh, this guy's an addict, he's an alcoholic, he's a junkie, he's going to stay like that. So we brush it off. They come with an overdose or withdrawal. We're okay to take care of them for that acute episode that happened into the hospital. But doctors are not trained to either deal with them on a regular basis, on a longitudinal basis, or treat them on a longitudinal basis. So that's where that statement comes from. And it is still true even today. Most of my patients do not like going to the pharmacy to pick up the medicine, go to the emergency room. Everybody makes fun of them, they demean them, and that has to change. The stigma towards the disease and the stigma towards the treatment, they're both very bad and a big drawback towards people getting help.
You'd mentioned earlier some of these opioid blockers like Suboxone. I think that's the right term. I don't know if that's the right medical term.
Yes.
But I have friends that they refer to themselves as clean, but they are every morning they're going to the methadone clinic. What are your thoughts on methadone clinics, and are they working? Are they helping?
So methadone has been around for over 50 years. And a lot of people in the methadone clinics are working people. So if they have to go to work 7 o'clock in the morning, they wake up 4 o'clock in the morning, go to the methadone clinic and do a P test or whatever is necessary that day, get the daily dose, then go to work, and next day do the same thing. So it was a first step that came out in early 70s, mid 70s to curb the use of street drugs. And the studies showed in the beginning that people gained, the society gained, but the addiction was still there. So it did not cure the addiction. Neither does Suboxone cure the addiction, nor does we can cure the scars that have been caused that led to the addiction. A lot of these people have been abused physically and mentally and sexually, financially, and a lot of other ways. And those scars will never go away. So it is a very, very difficult condition. Very few people understand, and we need to be compassionate and take care of them in a proper way.
So, people listening right now or watching on YouTube or what have you, what can they do to help? Let's say they're not, but they're compassionate. They want to help. I know you have a foundation. Talk a little bit about the foundation, and also people who are listening right now, in addition to picking up your book, just that will ultimately help your foundation, because I know the proceeds go to your foundation, but what can the average everyday person do to help with this?
Well, the foundation is called Resolve America's Opioid Epidemic Foundation. We clearly thought about it, what makes sense, what resonates with the people. The mass media is not very interested in talking about this topic. So we have to go about through the social media, through podcasts, and it's very time consuming, financially challenging, and otherwise challenging for a person like me who's never been on a social media. So people need to contribute. People need to ask our legislators questions about it. If million plus people have died, there's probably 20, 30 million relatives that are sitting around suffering in their houses, in the basements, and not being able to talk to anybody. I think we need to all get together and have a mass momentum. I'm not trying to ignite anything here, but we need to raise up and ask questions to resolve this issue. Not wanting to talk, not wanting to do anything, not knowing what to do anything, those are not the answers here. As a physician, our vocation is to help people, keep them healthy and alive. Unfortunately, the younger segment of Americans between the ages of 18 and 54 are dying at a very fast pace without access of doctors. And I ask myself, why? And these conditions are called opioid use disorder or substance use disorder. These people are otherwise healthy, and they're dying from polydrug overdose. Today's fentanyl, methamphetamine, heroin, and cocaine. Prescription drugs is not an issue for the last 6 to 7 years, which was a problem 10, 20, 30 years ago. Over 1 million people, million doctors in the country, 600 nurse practitioners and PAs, and only 1% of them are actively involved in taking care of patients with substance use disorder or addiction problems. And I asked why. We have a national crisis. CDC said 41 million people are at risk, 2.4 million people are in treatment. By the way, these people are doing very, very well. They are productive citizens, pays taxes, goes to church, take care of families, go on vacations, buying houses, good clothes. And nobody is showing these people how well they're doing. The media just keeps on showing the doom and gloom. Another person died with a needle in the arm. The death rates are going up. And I already mentioned about the 14,000 facilities in this country that are inpatient rehabs, but only 18,000 providers that provide outpatient care. If we need to reverse this, we need to have 200, 300,000 providers that are actively providing without limits, regulations, and oversight. We need to change the curriculum in the medical schools as to start teaching the new doctors. It may take a decade for the next generation, but at least we'll be ready full-fledged in 10 years to tackle this problem head on, and we won't have to think about it. I do not know why that has not been done. I also am concerned about the harm reduction policies that have been again and again intensifying, push more Narcan, give the patients more needles and clean heroin and stuff. That policy should be for short-term goals that, hey, in the next 3 to 6 months, we're going to fix the problem with all the 41 million people have access to care. And then in the meantime, to save them, we can have these harm reduction policies. We cannot have harm reduction policies going on for the past 20, 30 years. And what is the consequence? The death rates are going up. Hepatitis C, now I was talking to a hepatologist. The hepatitis C increases about 100,000 new cases every year. And it's a very expensive and deadly condition. And all the burden goes on to the insurance companies. So we need to limit this harm reduction policies. It's compassionate, it's necessary, but I'm saying it's only for short-term use.
Yeah, I mean, I've heard of, again, it's somewhat anecdotal, but you know, you hear of addicts that intentionally go to a detox, you know, a 7-day detox, knowing that they're going to come out and they're just going to go straight to whatever their drug of choice is, and they know that if they OD, that they'll just get Narcan. And like, I mean, is that a real thing, or is that just me just hearing some stories of people I know? Is that really happening?
No, so Narcan was started in 2017, 2018. We did see a dip in overdose deaths around that time from 70,000 to about 68,000. It was not anything else that the government had done or policies changed. And then with the COVID epidemic, the death rate has gone up 30 to 40%. It's really 40%. If you look at 68,000 versus 104,000 in 1 year's time, that's 40% increase in the overdose deaths. So that rate, we will literally vanish the 40 million people that are at risk in a decade or two if we do not fix the policies. Unfortunately, the fentanyl is very, very deadly in very minute amounts, and it's even being laced now. We see in coming with people's marijuana test. So,
I was going to ask you about marijuana, and you know, I didn't read the whole book yet, but what are your thoughts on that? Because I have actually, you know, talked with doctors that are treating the opioid epidemic with THC, not necessarily smoking marijuana, but they're helping people titrate. I think that's the term, to come down off of it in long term. What are your thoughts on that? What's the science showing? Is it helpful? I mean, we're here in Massachusetts. I know you're in Michigan. I don't know what Michigan's like, but you know, it's fully legal here essentially. But you know, what are your thoughts on using, you know, this what the country has called the drug marijuana as a way to get people off of opioids?
So this is a class 1 drug as far as the federal government is concerned. In the state of Michigan, like 33 states, it's either legalized or decriminalized. The problem is 20 years ago when I started learning addiction medicine, marijuana was 4% potent. Now it's 25% potent. It's a totally different animal. It's frying up the kid's brain at a very fast pace, and their comprehension and ability to learn is going down very fast if they start at a much younger age, which most kids are doing these days. So it is definitely proven to be an entry drug. All my patients, 99% of my patients that ended up with addictions started with marijuana. Some started with alcohol, some started with pills, but everybody is using marijuana. Today's marijuana is not studied from an academic standpoint and research standpoint with other drugs, and there is no proven efficacy that you can stop the heroin or the narcotics and just deal with the marijuana and you will not have any problems. That is not true.
Yeah, there, like you said, it's still today, marijuana is still considered a class. What are your thoughts on that? Do you think it should still be in the same category as heroin and cocaine?
Well, for the past 3-4 years, the federal government is struggling with the discussion on the fentanyl. Fentanyl is a class 2 drug. Hospitals use in the hospital setting surgeons for a quick surgery and pain relief. We guys used to use fentanyl patches, class 2 drug, for chronic pain because it covers the pain for 72 hours. In 2014, we started seeing fentanyl in the drug test. And at that point, we had no idea about the illegal fentanyl. So we were subconsciously forced, hey, it could be my patient that is doing it, even though the patient is 78 years old and I know the patient is using the patch. So 2-3 years later, around 2016, we started hearing this illegal fentanyl. And 3 years ago, the federal government and the White House and the researchers were struggling to make fentanyl class 1 drug. The researchers said it is not practical to do research on a class 1 drug. So if hundreds and thousands of patients are dying from fentanyl, and that's still a class 2 drug, and people are not dying from marijuana, it doesn't make sense in today's market, in today's circumstances, to keep that as class 1 drug.
And what do you think it is? I mean, do you think it's just legislators, just not wanting to get behind a bill or something like that? I mean, I know there's a bunch that are pending, but is that really it? Does one of these, congressmen or senators just not want to put their name, associated or be the, the lead sponsor of these types of bills that would, when we're talking about, decriminalization, we know that, the federal government has essentially done that without really doing it, but is that really what's going on? Like, why can't we just get our shit together with that? It does, like you said, you just said it yourself. People aren't dying from marijuana. I've never smoked marijuana, never smoked a cigarette. But I'm 47 now. Jeez, I can't believe I'm that old. And you know what? I have now tried like CBD and a THC kind of combination, just because of the products that I've sold and been introduced to that. And I've always been anti-marijuana because of what you just said. It's a gateway drug. People don't like it. My father doesn't drink, but he's been smoking pot since he was a kid, so I have my family members like that. So I've always been anti that. And then, I tried like in a CBD THC kind of like gummy or what have you. And I was like, all right, I kind of get it. I'm 44. I was 44 at the time. It's a little bit different. I wasn't 16. What is it like? Is that it? Are congressmen or congresswomen or senators just not willing to get behind it because there still is that stigma to marijuana?
Well, money talks. So marijuana business is a big money, and eventually the business end will prevail and medicine and science will fail, I think. Mm-hmm. If double-blind studies are not done with combination of marijuana, THC, and the other drugs, so we do not know if a bad outcome occurs, how much contribution is because the THC was too strong, or if it's laced with other street drugs. So it's a very big legal problem also, but it's an academic and research inadequacy that has not been figured out. There are some conditions where THC and CBD oils could be useful in resistant seizures. People use it for anxiety and depression and chronic pain. And they say, my patients use it and they say they feel better.
You talk about, I was looking at, your press kit that you put together. And again, it's remarkable what you're doing. Again, putting yourself out there and spending your own resources to really kind of get the word out and help people. But you mentioned briefly, I was reading it, and there are some things that you've omitted from the book that aren't in the book. What are those things and why did you omit them?
Well,
Do we not want to talk? We don't have to talk about it. Let's not talk about it. Let's skip it over. I'm going to skip it over. Look, you know what? You already put yourself out there, so I'm not going to put yourself out there anymore. So let's just skip over. All right. So look. I know you're a busy guy. And your schedule is crazy because you are still a practicing physician and you're doing this try to help people. Before I let you go, do you have any last thoughts for people listening right now that you want to share with them that we haven't already shared?
Well, my last thoughts is that we do have some good news. And the good news is from the Data 2000, which allowed doctors like me in practice to do a course, pass an exam, and get an XDEA number that only these doctors can take care of patients with addictions to write medications. So there are only 18,000 providers that are actively involved in this care. But 106,000 do have the necessary credentials. So 90-some thousand are sitting on a sideline. Either they don't have enough resources, knowledge, experience, education, or desire, or they're afraid of the regulations. So we take all the regulations, limits, and oversight out, and all the new 500 regulations that have been passed in the last 20 years to curb the pills and pill mills. These 108,000 providers could take care of 10 to 20 million people overnight. And I think that's the biggest step that we can do to resolve this on a very fast basis. Secondly, physicians tell me the government has not put in any incentives for doctors to jump into this field. And they may have to entice doctors by giving some incentives to counselors, to doctors, to the addiction doctors, whatever it may be, so that they get more interested and less feel that they're going to get into trouble themselves taking care of these people.
Yeah, I was going to ask you about that, the incentives, because, it's been going on, whether they're regulated, not regulated, on the side, under the table, over the table, doctors. And you've probably seen it throughout your career, and you've seen doctors go down as a result of it too. But yeah, you're right. I think that is important. Look, we live in a capitalist society. And if you're a doctor and you go through the education that you've done and you're continuing education and all the work that you do, you should be compensated for the work you're doing, especially if you're going to even take risks. So that makes a lot of sense. Listen, I want to thank you for spending the time. As we've talked before, this is something that's important to me. And if you've been listening right now, we've been on with Dr. Arun Gupta. He wrote the book, The Preventable Epidemic. Look, it's available everywhere. You can go to thepreventableepidemicbook.com. You can pick it up right on Amazon. People like to do it there. You go to Barnes & Noble, wherever you like to buy books, the book is available. But also, just visit thepreventableepidemicbook.com. There's a lot more than just the book on there. He talks about his foundation that he started. Look, this guy should be retired right now. You should be on a beach right now, just relaxing. And, I don't know if you have a drink or whatever, but he's not doing that. He spent 35 years of practice. And now he's decided over the past few years, he's really dedicated himself to helping others, to changing, to making a change. And you know what? And a lot of us talk. This guy is taking action. So again, go to thepreventableepidemicbook.com. Again, thepreventableepidemicbook.com. Pick up the book, but also, if you want to help, there's ways you can help. You can donate to his foundation. He gives you certain things you can do as well. Reach out to your, look, you can start at the municipal level. Okay. It doesn't have to be all the way up to Congress, but we got to start somewhere. If we want change, we need to go out and actually make it happen. Dr. Arun Gupta is doing it. This has been another edition of the Alden Report. My name is Mike Alden. That's Dr. Arun Gupta, and we'll see you soon. Today's episode is brought to you by FrontRowBenefits.com, connecting consumers and businesses with front row access to the greatest health insurance that the United States has to offer. Visit FrontRowBenefits.com. Folks, listen, if you're like me, if you own a business, if you have a family, or if you're an individual and you're looking for front row access to healthcare, maybe you're tired of your premiums going up. Maybe you don't want to pay those high deductibles anymore. Maybe you're tired of paying more and more for your monthly prescriptions, and you want to make sure that you're getting that VIP access, that front row access. Then visit FrontRowBenefits.com and get a free quote. They're connecting consumers and businesses with the top level insurance carriers in the United States at discounted prices. Visit FrontRowBenefits.com. That's FrontRowBenefits.com.